The carpal tunnel is a space in the wrist that holds the tendon and median nerve. This space is compressed in the carpal tunnel syndrome. When because of any reason the carpal tunnel compressed, eventually median nerve compression occurs, and that causes the symptoms like numbness, weakness, and tingling sensation in your hand. Carpal tunnel syndrome occurs when the tunnel becomes narrow and there is a swelling of the tissue in the carpal tunnel, that putting pressure on the median nerve and reducing its blood supply. This abnormal pressure on the median nerve can result in the numbness, tingling pain, and weakness in the hand. Studies have shown that women and older people are more vulnerable to develop CTS. Other causes for carpal tunnel syndrome includes repetitive hand movements such as typing or machine work are more vulnerable to get you CTS because it can irritate the tendon which is run through the carpal tunnel. Genetic predisposition is one of the causative factors for CTS. Obesity can also lead you to CTS. Some autoimmune disorder such as rheumatoid arthritis can cause inflammation and swelling and eventually causing CTS. During pregnancy, the hormone associated with the pregnancy can cause general fluid retention which can compress the median nerve. Traumatic injury can also lead you to carpal tunnel syndrome. Partial dislocation and fractures around the wrist may compress the median nerve and causes you the carpal tunnel syndrome. When you get carpal tunnel syndrome, you will have pain and numbness in your wrist, pins and needling sensation in your thumb, index finger and middle finger. Pain is significant at the night if the wrist is in bent position for a long time. As it progresses, your symptoms will become more prominent during the day with certain activities such as driving, holding phone or gardening work. You will get weakness in your grip strength. Loss of hand function, difficulty in grasping small objects is one of the common symptoms of carpal tunnel syndrome. There may be wasting of the muscles at the base of your thumb when you have carpal tunnel syndrome. Diagnosis for the carpal tunnel syndrome includes following tests. Number 1. Imaging test. X-ray, ultrasound or MRI can helpful to know the reason for carpal tunnel syndrome and confirm the diagnosis. Number 2. Electromyogram. Your doctor puts a thin electrode into a muscle to measure its electrical activities. Number 3. Nerve conduction study. Your doctor taps electrode to your skin. It will measure the signal in the nerve of your hand. Medical management for carpal tunnel syndrome includes medication such as anti-inflammatory drugs or steroids to reduce the pain and swelling. Wrist splint will immobilize the hand and prevent the further damage. Along with this, do some lifestyle changes, and if still there is no relief, visit your physiotherapist and get proper treatment. If none of the treatment is work, you might have an operation which is called carpal tunnel release that will increase the size of your carpal tunnel and ease the pressure on the median nerve. There are mainly two surgical procedures for carpal tunnel syndrome. Number 1, open carpal tunnel release, and number 2, endoscopic carpal tunnel release. Your physiotherapist will perform following examinations to confirm the carpal tunnel syndrome. Number 1, Phalanx test. The patient is instructed to compress the back of the both hand up to the 30 seconds. If symptoms provokes, the test is positive. Number 2. Reverse phalanx test. The examiner places the patient's wrist in maximal extension but not overpressure. This position is maintained for 60 seconds. If symptoms provokes, the test is positive. Number 3. Tinel's sign. The examiner tapping with two fingers over the path of the median nerve. The test is positive if patients feel paresthesia or tingling pain. Number 4. Paper holding test. A patient is asked to hold the paper between thumb and index finger. The physiotherapist then attempts to pull the paper out of patient's hand. A normal individual will be able to maintain the hold, while CTS patient fail. Physiotherapy treatment for carpal tunnel syndrome. Ice therapy can be used by applying ice to the wrist for 10 to 15 minutes once or twice an hour. Heat therapy can be applied by immersing the affected hand in warm water. Ultrasound therapy is used to break the adhesions and increase the circulation and improving range of motion. TENS is highly effective to reduce the pain and swelling. Laser therapy is used to decrease the pain and paresthesia. Laser therapy is also approved by FDA for treatment for carpal tunnel syndrome. Manual therapy. Manual therapy include mobilization of soft tissue, carpal bone and median nerve. This will help to increase the mobility of the nerve and improving range of motion. Stretching exercise. The arms are placed in front, spreading the fingers and then stretching the wrist and fingers as far as possible as shown in the picture. Holding this position for 20 seconds. Strengthening exercise. Strengthening exercise helps to strengthen the hand and grip. This will include squeezing of soft ball exercise, wrist curl exercise, and other resistance exercise. Iontophoresis is also found to be effective in carpal tunnel syndrome. Patient education is one of the important things of physiotherapy management. The patient is advised to avoid inappropriate and provoking positions and continue strengthening and mobility exercise, which will help the affected arm to recover. The patient is also educated on how to manage CTS symptoms and modify activity of daily living. Do change what causes carpal tunnel syndrome. Do take pill as directed by your doctor. Do briefly take off wrist splint while you are trying to exercise. Don't hit the things with the butt of your palm. This may injure your median nerve. Don't delay getting treatment. Don't use vibrating hand tools. Don't hold your hand or wrist in awkward position. Don't use repetitive movements, especially punching or grasping. Follow the do's and don'ts for fast recovery.